Let me tell you more about how propaganda essentially works for conservative media. Here's the Waco Tribune. And the Waco Tribune, right here in black and white, Texas still ranks top ranks of uninsured. Now, I'm looking at the article. 1 in 4 Texans did not have health insurance in 2011. 23% of the population, that's 5.8 Texans, did not have health insurance in 2011. That's 13% of children, 22% of women, 24% of men, and 26% of the employed workforce in Texas. Which businesses and corporate profits in Texas have been up. Why is a little thing like health insurance not put in those bills? Well, somehow there's a big cost to state businesses here in Texas. That means that your health insurance will never be here. 3 million people in the state could have coverage by 2014. So, 3 million is not a bad number. And there's plenty of corporate profits to go around, which is, those things called margins. As the wage has stagnated, profits have gone up. And in that little bitty bubble here in Texas, some of those billions of dollars that are going to private corporations such as the oil subsidies could go into a little thing called health insurance for all employees. But of course, we can't have anything like that because it costs business too much, as Rick Perry seems to want to suggest. But let's go ahead and talk about the largest percentage gain in insurance coverage of any state under healthcare reform. Now, what would happen here? Health insurance to inform consumers of health plan options, subsidized coverage for households up to 400% above the federal poverty line. The insurance mandates and penalties for not purchasing health insurance. I believe that's $700. Insurance mandates, blah, blah, blah. An expansion of Medicaid to cover individuals and households 138% below the federal poverty line. So if you're making less than $20,000 and less, up to $35,000 now, that's 138%, I believe, you'll have health insurance, allowing young adults younger than age 26 to stay on their parents' health insurance or their parents' health plans, which is a godsend. Tax credits for small businesses and nonprofit groups, which will cover at least half of premium costs for employees' health insurance coverage, which isn't a bad idea, but of course Rick Perry is keeping his fingers crossed and already implementing Medicare and Medicaid while sitting here and publicly opposing those issues. Now, the U.S. Supreme Court said that, of course, it was constitutional, and Perry called the federal health care reform provisions brazen intrusion into the sovereignty of our state, which is absolutely ridiculous because he's taking the money anyway. Now, he said he looked forward to implementing other healthcare solutions, but he's not saying which ones will have to be implemented because, of course, they just want to repeal Obamacare, which is one of the first universal healthcare systems here in the United States. The man's not. I'll leave that thought for another day. So, the caring for Texans is a multi-billion-dollar annual expense on Texas business and state healthcare systems, where we've had $5 billion for uncompensated care to uninsured patients in 2010. That's $5 billion that is being spent that could have went to preventative costs and preventative health care in some way, shape, or form. But instead, we have the system that we have right now. So, of course, the taxpayers ultimately paid that. And what are we supposed to do about it? We're just going to have to eat those losses as they go to health insurance plans. Not even health insurance plans, but they go into the healthcare system and they go into the 18% of GDP that is entire healthcare costs instead of preventative medicine. So, of course, here in Texas, we have more people that believe in private profit and the free market when absolutely none of this is true, and they've seen it for themselves when there have been CEOs in charge of America for the last 20 years and made Texas worse and worse. It's been worse for education. It's been worse for not just education, but teen pregnancies, as well as health insurance. And it's time for it to really, truly change, but nobody's really looking to do that here in Texas, unfortunately. So, Texas hospitals help finance the federal healthcare reform by absorbing $14 billion of funding cuts to Medicare and other hospital reimbursements. And yet, we continue to have more problems because it's not about private profit. This industry should be about one thing. It should be about truly changing what is going on here in the United States so that we have universal health care and possibly a single payer no matter who we go to. It's about preventing people from dying instead of the $2 billion or the $14 billion or the $5 billion that are being absorbed in uninsured patients to only get healthcare coverage when it's the most expensive. That's all I have to say about it for now. I hope somebody truly can understand that I live in a propaganda city where it's all about what conservatives want, and they're very, very, very disingenuous. I mean, have you seen this? Seriously? This is what I gotta deal with.